Welcome, colleagues. 254th day of heroic resistance of Ukraine. Here is Natalia Staroprawo, and we start our series of media briefings in Media Center, Ukraine. On the 14th of November is the World Diabetes Day, so let me invite Kseniya Tolubaeva, the doctor endocrinologist, tell us more about diabetes and what we should know about it. Good morning. Diabetes is a chronic disease, incurable disease as yet. That's why we as doctors and as the patient organization do our best to help people with diabetes to somehow compensate for their disease and to feel better. There are several types of diabetes, and depending on the type of diabetes, we decide what therapy we will prescribe to this or that patient. For the first type of diabetes, we begin with insulin right away because the patient in his organism, his pancreatic gland is not producing insulin at all. With the second type of diabetes, we can compensate for patients through pills and through compensation in terms of modification of their lifestyle. And they can also move to insulin, and they shouldn't be afraid of that because a lot of people are scared that if they start using insulin, that already means the end of their life. But this is not so. That will improve their life. For our patients to feel better, they need to control the level of glucose in their blood, and we have several devices for this. The basic ones are glucometers, which may look different. I've got this one, and they need the test strips for that, which means that the person makes an injection in the finger, a blood drop gets there, and on the display of the glucometer, we see the rate of glucose in human blood. There are also more advanced systems to control these are sensor devices, and using sensor devices, we don't have to make any injections in our fingers. And this reduces the level of traumatization, both physical and moral, psychological. I can actually show what this looks like. This is the center. It is small. It does not obstruct any of your movements and performance of any of your life duties. And the patient can control the level of glucose, feels better, and feels free to do his daily chores. And to inject insulin, we have also got the basic syringe pens with the needles for manual injection or syringes. And also we've got more advanced technologies for our patients, which is the insulin pump. It looks like this. It is also very small, but this device helps our patients more in the physiological way. It's kind of their pancreatic gland, which helps them to get the same amount of insulin at a specific point of time to avoid any complications, because if our patients don't have access to any basic technologies, which are glucometers and test strips, they are just going blinded in the tunnel, and they cannot be controlling the speed of their going, and they are just moving towards further complications, and sometimes these complications may really develop very, very quickly and be very serious. So that will mean disability, and disability not of the elderly people, but of young people who lose their eyesight, who have problems with the legs and with kidney. Let me invite Yuliya Vasyltsiv, the Chief Specialist of the Western Interregional Department of the National Health Service of Ukraine. Please, could you tell us more about the disease rate in Lviv region? Who has got diabetes the most? Welcome to everyone. Let me tell you what medical assistance could be provided to patients with diabetes mellitus under the Medical Guarantees Program. And let me start with saying that the first advisor for the patients concerning prevention, diagnosis of any diseases, including diabetes mellitus, is a family doctor. Taking into account the health condition of the patient, different risk factors, heredity, risk factors. The family doctor writes a referral for having consultations with neuro specialists, including doctors, endocrinologists. The package of free of charge services under the medical guarantees program at the primary healthcare unit, as far as prevention, diagnosis, and treatment of different diseases is concerned, including diabetes mellitus, includes measuring the level of sugar in the blood, cholesterol level test, consultations on the healthy way of living, referral to different consultations and tests. Also, prescription of medicines under the affordable medicines program in case of the second type diabetes, and writing a prescription for insulin on the basis of the prescription of the endocrinologist that is mentioned by him in the treatment plan. By the way, the affordable medicine program now includes 53 INNs, trade names of medicines which are used to treat diabetes of type 2, and 15 of them are free of charge. The other ones come with a small charge. And the registry of medicines that are released under the reimbursement program includes 72 insulin items, 45 of which are free of charge, and almost 48,000 patients with diabetes of type 2 have got under this program accessible medicine in the drugstores, the medicines, and 29,000 are patients from Lviv region. Almost 200,000 patients have got insulin, and more than 13,000 are patients in Lviv region. And in general, affordable medicines could be obtained in more than 12,000 drugstores, and 850 of them are in Lviv region. As far as insulin is concerned, more than 10,000 drugstores in Ukraine sell it, give it under the reimbursement program, and in Lviv region we have more than 750 drugstores like this. In case of type 2 diabetes, more than 10,000 drugstores release medications, and 1,000 of them, more than 1,000, is in Lviv region. The cost is reimbursed by the National Health Service of Ukraine, and since the beginning of the year, under the Affordable Medicine Program, the National Service has paid more than 560 million hryvnias. As far as insulin is concerned, the National Service has reimbursed to drugstores more than 1,290 million hryvnias. In particular, for Lviv region drugstores, this is more than 250 million hryvnias. Separately, I would like to mention a couple of words on the affordability and accessibility of such drugs in the wartime. Insulin and affordable medicines has been facilitated to the best extent possible over the wartime period, for the martial law period. So this means that if a patient has the e-prescription or the paper prescription from the doctor, can go to the drugstore and get the medicine. And if the doctor has some problems with electricity or the internet, he may write a paper prescription, and the drugstore should give the medicines. This could be done by the family doctor, therapist, pediatrician with whom the patient has got a declaration. And if we speak about insulin, to be more specific, the prescription is to be based on the treatment plan signed by the doctor endocrinologist. And also the prescription could be written out by any therapist or pediatrician or family doctor. If we speak about insulin, this is only doctor endocrinologist. And the affordable medicine guarantee, the medical guarantee program, ensures access to basic health care, and it includes 38 packages of medical services, which means that this is the list and the scope of medical services and medicines that the state guarantees to its patients, and paying for them out of the state budget at the unified price. That's why patients with diabetes have got access to the basic health care. Thank you, Yuliya. We will still get back to this topic, and now let me give the floor to Yuliya Kuklina, co-founder of NGO Dia-Dzen. Please tell us how your organization helps people with diabetes. Yes, let me tell that our organization Dia-Dzen NGO is actually the organization founded in Kharkiv, but for all the years of our existence, we've been helping people with diabetes throughout Ukraine because life of people with diabetes in Ukraine was never easy even before the war. And the means shown by Kseniya for measuring the level of sugar in in blood for insulin injection, unfortunately not covered by the state budget. These are expensive things people with diabetes have to buy on their own on a daily basis and use them throughout their lives. That's why our organization has been helping and before the war to those people. And when the war broke out, full-scale war broke out in this country, the first thing all people with diabetes faced was the fear of being left with no insulin, because insulin is a kind of a train we are taking, a roller we're taking to go. So our organization started cooperating with the ministry, with the National Health Service, other patient organizations of producers of insulin, and we supported all the possible initiatives. And thanks God, both the National Health Service of Ukraine, which is NHS, and the Armed Forces of Ukraine together somehow cooperated and managed to provide Ukrainians with insulin for all that period of time. But it's another story how we delivered this and are delivering this to occupied territories, to newly deoccupied territories where there is no electricity, mobile communication, no doctors, no drugstores. We keep working at this in the interaction with other organizations. As far as this train we are using, well, we need to know the rules, and unblinded eyes are our measurement of the rate of insulin in the blood and sugar in the blood. And everywhere in Ukraine and throughout the world, people of different ages have diabetes. That is the problem of everyone. That is a large category of Ukrainian population. And unfortunately, at the state level, there is no training provided to those people of how they should keep living with this disease. That's why, on an annual basis, we have a forum. We had this forum in Kharkiv, we had it online in the COVID times, and this year we will have it in Lviv. This is the forum on how you could learn to live with diabetes without losing your health at a fast pace and being happy in spite of this disease, in spite of having such a difficult and severe disease. Let's go back to the question, the issue of disease rate, morbidity rate in Lviv region. So, who is the most vulnerable category? Unfortunately, we don't have the statistical data for Lviv because we have been recently relocated from Kharkiv to Lviv region. That's why I cannot provide you this data, but I can tell you who belongs to the most vulnerable category. The science does not know the reasons for diabetes type 1 in young people, in children of people of middle age. So actually the threat is for everyone if we speak about first type diabetes, which is insulin dependent from the start. But if we speak about diabetes type 2, this is a threat for people who have an healthy way of living, who don't have healthy nutrition, healthy diet, who move not a lot in their lives, and of course people of senior age, because that is just physics. By that time the organism is more exhausted. How do we recognize the manifestation of diabetes, and in what cases do we need to go to the doctor? Well, let me speak about diabetes type 1, what you need to pay attention, what parents and younger children, younger people need to pay attention to. Diabetes of type 2 starts very slowly, and the family doctor will show you. Um, but the ongoing symptoms, the first symptoms of diabetes is the willingness to drink a lot, and as a result of that, unhealthy urine loss, loss of weight. the willingness to eat, good appetite. That is the mechanism. Sorry for saying this, but you have fatigue, you have migraine, you cannot sleep. So these are pathological conditions people often perceive as just that I've overworked, I need to have a vacation, and you can actually easily confuse it for the ongoing symptoms for diabetes. But if you are thirsty all the time, that shows that your level of sugar in blood is higher. You have mentioned occupied and deoccupied territories. How do people live there with diabetes in those territories? What is their access to medicines, and how do they support their life and activity when they don't have access to medicines? Well, to tell the truth, we differentiate between occupied territories and newly liberated territories, because in occupied territories, people have some stock of insulin, which is almost over. Some Russian occupation authorities are bringing to them. Also, we public patient volunteer organizations gather and try to somehow deliver this stock, which sometimes means several weeks of going here and there with those insulin boxes. And the problem is that people don't use their medicine that they uh, have selected together with the doctor, but this they just use whatever they have at hand. This is a hormone which is difficult to select, so that is the major problem, either lack of insulin or lack of the insulin you need specifically. I could tell you a story of Berdyansk, which is under occupation now, but we managed to give a box of insulins to one person who was our volunteer even before the war. But there is no mobile connection there, so she was just staying at the drugstore and gave it to people and shared it by word of mouth. And people were crying and expressing their gratitude because insulin is their medicine which you need badly to live on. Without insulin, an insulin-dependent person can live for several weeks, but he or she starts feeling very, very bad, even after one injection is missed. And let me tell also about the newly liberated territories. The situation is really worse there because there are no drugstores there. There is no mobile connection there to get the insulin prescription uh, for somebody to buy it in any country's city. So we will ask Lviv residents at our forum to bring one or two insulin devices, and we will give it to our volunteers in Kharkiv region who are going to the occupied territories, and we will try to supply patients with insulin there. So you have mentioned the forum, which is going to take place on the 12th of November in Lviv, if I'm not mistaken. So who could be interested in this forum, and what are going to be the key messages of this forum? Well, the forum is for people with diabetes and for relatives of those people because, diabetes is a complicated chronic disease, which is sometimes called a way of living, but it's a way of living in the sense only that the person himself or herself and all the people around them have to change their way of living. The forum is of awareness raising character, and it also has got the psychosocial goal because to change the way of living, to accept that you or your child, for example, have an incurable disease is a difficult thing to do. And parents feel over responsibility for that because they need to exercise control over the condition of their child. They need to calculate the weight of proteins and fats and in the diet of the child or in the diet of the person who is sick, who has first type diabetes. And also we face the situation when parents feel guilty that the child fell ill with diabetes, and that is also a major problem. And I could tell all the parents, and Kseniya will confirm this as a doctor, the reasons for contracting diabetes of first type in children are not known. So, dear parents, you are not to blame yourself. And for this reason, at our forum, we will have a psychologist who will have one general session for doctors, for adults, another one for teenagers, and she will be providing brief individual consultations if necessary in between the sessions, so if anybody is willing to get such a consultation. Also, at our forum, we will have lectures, trainings delivered by the doctor, to be more specific, Kseniya, because she's the member of our organization, and she will tell how you could learn to live with daily diabetes without losing in anything in terms of the quality of life, without taking the child from school, without stopping going to work or to cafes with your friends at the same time having diabetes, and without damaging your health. Kseniya will tell about that. And we will also have the representative of the National Health Service of Ukraine in the forum, and he will tell about the opportunities for people with diabetes. In particular, we have a lot of inquiries about people who are IDPs because they quite often don't have the necessary information. And even among our volunteers, we have people who came to Lviv several months ago and they don't know that they can actually address any healthcare institution in Lviv, in spite of the fact that they used to live in another region of Ukraine, and they may get some e-prescription for insulin. So we will also speak about that. And also, we will have other NGOs represented at the forum. They may also be helpful for people with diabetes. These are NGOs from Lviv region, our organization. We want to provide information to people about how NGOs and public associations could be helpful and what assistance could be provided by them. And also we will have two parallel directions in the forum, one for adults and one for children and teenagers. And that is really important because children with diabetes quite often are isolated, are shy because of their disease. So we want to give an opportunity to children to discuss these issues with the teenagers and children who have the same problem, and we will have also a person having some entertainment with little children, and we will have a psychologist working with teenagers, and we will have a session of a 15-year-old Roman who will share his experience of living with the new gadgets Kseniya has shown you. So to sum it all up, we would like to stress that we are living under martial law, and quite often the question is how long a person could live having diabetes and having no insulin, and can there be any replacement therapy? Unfortunately, no, because insulin is the hormone produced by our pancreatic gland, and people with diabetes of type 1 don't have it generated by the pancreatic gland, so unfortunately it cannot be replaced by anything else. For how long a person can live? Well, a person, well, this depends on the condition of your health, of your organism. Somebody may live several weeks, somebody may live in a little bit more than a month. This depends on a lot of things, on a lot of factors. So if you could repeat the factors, it depends on. For example, if a person injects insulin, there is one long effect insulin, like 24 hours or 36 or 48 hours. And there is also the insulin pump, which has just a short effect insulin up to 3 hours. So if a person doesn't have a chance to inject this short effect insulin, unfortunately the person will live only for several days because metabolism is in disorder, and the metabolic substances will not be taken out of the body, and the person will be feeling worse and worse, and then will faint and die if he or she doesn't have insulin, unfortunately. Thank you. So let me remind you, we have had Kseniya Tolubaeva, endocrinologist, Yuliya Vasyltsiv, chief specialist of the Western Interregional Department of the National Health Service of Ukraine, and Yuliya Kuklina, co-founder of NGO Dia-Dzen. Thanks a lot for this talk and for this meeting. Let me remind you that we are meeting each other at